Hi, welcome. I am so excited to have with me today Dr. Shoshana Bennett, who has become a very close friend and is just a wonderful expert in all things prenatal and postpartum mood related. I'm going to give you a little bit of background, and then we're going to talk about just a couple things that are really important for people to know about in this regard. So, after two life-threatening bouts of postpartum illness, Dr. Shoshana Bennett helped pioneer the field of maternal mental health. She founded Postpartum Assistance for Mothers in 1987, became president of California's state organization Postpartum Health Alliance, and then served as president of Postpartum Support International. She's the author of Children of the Depressed, Postpartum Depression for Dummies, Pregnant on Prozac, and several other books, and has helped thousands and thousands of women online get through some trying times. So welcome, Dr. Shosh.
Oh, thank you, Jess.
Yeah, it's great to have you. So you're going to be heading up a program on My Yoga Living for our members called Prenatal Postpartum Moods for Mamas.
Right.
Tell us a little bit first about why this whole subject is important for people to know. Is it just certain people who should know about it, or why would people need to look into this?
Everybody who's planning on having a baby should have the information. You know, over the last 30 years, what I've heard more than anything else when women finally get in touch with me is, why didn't somebody tell me? You know, because it's not difficult to handle if a postpartum depression, for instance, pops up. But if you don't know what to watch for, you know, then it can keep going longer than it needs to. So we want to know, everybody should know what is, you know, falls within the normal realm and what might need some extra assistance to feel good. But this is nothing to be, you know, worried about. And many, many mommies and moms to be will contact me and say, you know, I'm pregnant. My moods are doing this. They're shifting like this, or my appetite's changing, or my sleep is changing a bit. Is this normal? And often just what I do is help them normalize it. You know, if often it does fall within that normal stuff, but again, I'll make sure they have the supports in place to make sure they can prevent, you know, an illness occurring.
So this is really something that you've decided you want to help everybody to understand, and that's why you're going to offer this for free for our members.
Exactly.
Well, what exactly will you be doing to help people understand, you know, the signs to look for and what to do about them?
Well, I will certainly be posting some information they can glance at very, very simply, but they will be able to get in touch with me through Dr. Shosh at myyogaliving.com. And if any question comes up, they can just email me really quickly, and I will be answering those questions in a very interesting way, which I'll let you describe how that's going to work. But I'm really, really looking forward to it, you know, because it's nothing to be worried about. And, you know, often pregnant moms and new mommies, even mommies with school-age kids, you know, are saying, you know, I don't know, you know, what I should be doing with these moods, and maybe I'm afraid to find out. I don't want. Nothing to worry about here. This is so handleable. And so I want to encourage, even if you're not sure what's going on mood-wise, just ask me. And I'll be so happy to help. I mean, this is, you know, 15 to 20% of pregnant moms and new moms feel something maybe a little bit outside of that normal realm. And again, there's so much we can do, having nothing whatsoever to do, often with medication, that you can do just to, you know, start feeling the way you're hoping to.
All right, and just one more thing. What are some signs that you might look for that, maybe it's a good time to reach out and at least just say, hey, this is what's going on with me. What are your thoughts? Get a little support for that. What are the signs? I mean, people during this time are generally exhausted and stressed out and full of anxiety. There's this new being that we're responsible for, and it's all new, right? So it automatically comes with, I think, a lot of stress and fear. So what are some signs that maybe we should maybe get a little more support?
Well, even before that, taking a look at pregnancy for a second, generally speaking, your appetite should increase. So if there's something medical going on, that's making you lose your appetite, that the doctor is aware of and helping you with, that's one thing. But if you find that it's more anxiety stuff going on and you're not looking forward to the future, you're very, very anxious, or it's a sort of a doom and gloom and a lot of worry. If you're not able to sleep at night, outside of the usual belly growing and maybe peeing extra times at nighttime, outside of that normal stuff, again, this is a sign that you might want to talk to me, and I'd be so happy to find out what's going on and give you help. Certainly, as you were saying, I mean, having a new baby is chaotic and exhausting, I mean, just in and of itself. So, but there are ways to tell whether you might need some help. For instance, if you're not able to sleep at nighttime when your baby is sleeping, if there's any kind of difficulty sleeping, that's a sign that you should get help. And again, it might be a very simple kind of a fix-it thing, but I will help assess. And the smartest doctors ever will say, when their patients come to them saying, you know what, I'm just not feeling right, and I think something's going on, and what's happening, they'll say, I'm ready to prescribe you something if you need it, but first get a full assessment. And so that's what I'll do. I'll make sure, I'll ask about support, and I'll ask about nutrition, and I'll ask about how you've set things up for yourself to help, make sure you have all the supports in place and those pieces of the wellness puzzle in place. If you're losing your appetite, if you're not hungry, a new mommy should be hungry. If you're not letting yourself eat, if you're just focusing on baby and not taking care of yourself, that's a whole other issue that we can certainly also talk about. But, if your appetite has decreased significantly, that's also a sign, to pay attention to.
Wow, wonderful. That's really helpful. And I know you have just so much information and knowledge and wisdom, and I just so appreciate you sharing it with our My Yoga Living community. If you're out there thinking of becoming a member, join us. My Yoga Mamas gives you access to prenatal, postpartum, family yoga, and wonderful Dr. Shosh. And once you're a member, you can email drshosh@myogaliving.com, Dr. Shosh at myogaliving.com, with your questions. And once a month, we will host an audio where Dr. Shosh will answer our specific questions, or you can ask her for a one-on-one assessment. So thank you so much for being here, Dr. Shosh.
It is my pleasure, and I so look forward to hearing from My Yoga Living members. Very much.
Right on. Thank you. Namaste.
Namaste.